on to look at platelets and hemostasis. This has to do with clotting of the blood, wound healing, a really important function for homeostasis, a really protective function to prevent us from bleeding out, right? There are three processes involved in hemostasis. And if we look at the word hemostasis, we can kind of indicate what's going on here. So stasis means stagnant or stopping, and hemo means blood. And that's the process that we're trying to bring about. We're trying to stop the flow of blood by coagulating that blood in order to facilitate tissue healing. So the three processes involved are vascular spasm, platelet plug, which is the primary mechanism of stopping that blood flow and beginning the wound healing process, as well as the formation of a more permanent blood clot, which we'll speak about, called a thrombus. So vascular spasm is basically the blood vessel's way of minimizing blood loss. This is basically constricting that vessel, vasoconstriction essentially, to decrease the amount of blood that could be lost as a result of this injury. So think about you pricking your finger like a paper cut, or a prick on your finger that bleeds, right? You want to minimize that blood loss as soon as possible. And the first part of doing so is vasoconstriction. Now, there are two mechanisms to facilitate this. There's an intrinsic ability of the vessel, part of the natural vascular response to vasoconstrict, but we also involve the sympathetic nervous system, which we know is a potent vasoconstrictor with some neurotransmitters that we already spoke about, okay? This also begins another process. This begins a process called platelet adhesion by creating this sticky nature to the endothelial layer. So to kind of describe this a little bit more in terms of the anatomy, you have a blood vessel, right? There's a lumen where the blood is flowing. There's that outer layer of the blood vessel. We know most of our blood vessels are one cell layer thick, so they have that endothelial capillary lining, and then you have a basement membrane, a subendothelial lining. And so when you cut a blood vessel, even if a very small vessel is cut, you're going to expose the underlying subendothelial tissue to the lumen of that vessel. And that's the trigger for all of this to start happening. So the endothelial layer becomes sticky, and that kind of attracts some of the factors that are in the blood to start aggregating at the site of injury and begin this process that we'll look at further. Okay, so the second part of this here is the platelet plug. So the first part is vascular spasm. We're going to vasoconstrict to prevent blood loss. The second part is the platelet plug. Now this is formed by platelets, which we also call thrombocytes. These basically start aggregating at the site of that vessel injury, and they begin to secrete substances that are necessary to clot the blood in that area, again, in an effort to minimize blood loss in that area. Now, the components of platelets are basically colorless fragments. So they do have a few organelles, and they do secrete a few substances. We'll talk about epinephrine and serotonin are examples of those, but they don't have a nucleus, so they can't divide or reproduce themselves. But there are quite a lot of platelets in the blood, about 100,000 to 500,000 per cubic milliliters of blood. And this is a really important part of clotting, right? These platelets. So here's a really general overview of what happens as a part of this platelet plug. This phase is called platelet adhesion, and this is going to be different from platelet aggregation, which is the next step that I'll talk about. So make sure you're making that distinction in your notes. So you have an injury to a blood vessel, you expose that subendothelial layer that I mentioned earlier, and exposing that subendothelial layer triggers this factor called von Willebrand factor to bind to the collagen fibers that are in that subendothelial layer. Okay, so I'll say that again. We have that endothelial layer, we've got the subendothelial layer, which is basically loose connective tissue. We got collagen, elastin in that layer. And so when we expose that subendothelium to the blood flowing in the lumen, that von Willebrand factor, which is floating around in our blood, right? It's always in our blood, being exposed to this area of the vessel, it starts to stick to those collagen fibers. And that's where this entire process begins. So von Willebrand factor binds to the collagen fibers, and then platelets, which are also always floating in our blood, bind to that von Willebrand factor, and three things come about as a result of this initial stickiness of the platelets. We have platelet adhesion, so they start sticking to that factor, which is at the site of injury. We have the stickiness of platelets, so they're going to start aggregating more platelets, and they're going to start clustering and clumping on top of each other. And then we have some important substances that are secreted. Epinephrine is one of those substances, and serotonin is another, and we'll talk about those on this slide, okay? So after that adhesion, then we move to platelet aggregation. So this is where that platelet begins to secrete ADP, adenosine diphosphate, and adenosine diphosphate increases the stickiness of those platelets. And this is one big positive feedback event. ADP is being secreted by platelets. ADP sequesters or calls more platelets, and those platelets also secrete ADP. So there's just a large positive feedback effect of ADP increasing the stickiness, aggregating more platelets, and that's further potentiated. Serotonin and epinephrine, which are also secreted by platelets, facilitate vasoconstriction. That's going to help with minimizing the blood loss. Then there's some other important chemical factors which we'll speak about going forward. These are basically plasma proteins that are really important in the coagulation process. Thromboxane A2. Now, thromboxane A2 is another mediator of this platelet plug formation. This is basically going to secrete ADP, that's its first job. It's going to stimulate vasoconstriction, that's the second role, and it's going to further platelet aggregation. So it's going to call or sequester more platelets. So I'll say that again. The three important functions of thromboxane: it's going to secrete ADP, it's going to aggregate more platelets, and it's going to also facilitate vasoconstriction. So we can see how this is one big positive feedback event. Factors potentiating more factors that are doing pretty much the same exact thing. Okay. All right. Now, at the site of injury, we want to clot the blood. I'm seeing some puzzled faces. Sure. So thromboxane A2, I'll jump back here. Three important functions: platelet aggregation, vasoconstriction, and secretion of ADP. Okay. All right. All right. Any other questions? Okay. So we want to potentiate or stimulate this platelet plug at the site of injury, but we do not want to have this platelet plug forming in areas where there is not platelet injury or endothelial injury. Okay, do you guys have this slide, right? Oh, okay. Yeah, so we need to prevent excess platelet plug formation in healthy, normal endothelial regions. And that's where two important substances come in. Prostacyclin, also called prostaglandin 2, and nitric oxide help in that, that function. They help to produce an anticoagulatory effect in normal, healthy endothelial tissue, and that's basically preventing that platelet plug formation where we do not want it. Why is that important? Why is that important? Exactly. If we have clotting or platelet plug formation in healthy, normal vessels, that can obstruct the flow of blood, right? That's how we get strokes and ischemia and heart attacks, by obstructing the flow of blood with that clot inappropriately. Okay, so on this image, we can see what happens in a damaged endothelial vessel, a damaged vessel. We have platelets being adhered. So this is the exposed collagen of the subendothelial layer. This is the lumen where blood is flowing. This is where the platelets are found. This is where we have platelets being aggregated to the site of injury. And once they aggregate to that site of injury, they begin secreting those two substances. They secrete thromboxane A2 and ADP. Thromboxane A2 will further secrete more ADP. It will aggregate more platelets, and it will also facilitate vasoconstriction, okay? So one big positive feedback cycle that's happening to potentiate the clotting of this region. Now, in normal blood vessels that are not injured, we have prostacyclin and nitric oxide, which are preventing this whole process from happening, okay? Now, an important question that may come up is nitric oxide. So we talked about nitric oxide before. We know that it is a vasodilator. And so the question may come up, well, if we're trying to vasoconstrict, won't nitric oxide counter effect that? And the answer is that the effect of epinephrine and serotonin overwhelms that vasodilatory effect of nitric oxide. Okay, so just something to bear in mind.